Hello and welcome to this Rethinking Anatomy video. In today's video we're going to be looking at the gluteus maximus, so obviously one of the most important muscles to know in the body due to the fact that people really want to train this muscle. So it's regardless of what you're doing, people usually want to train it for hypertrophy and function, and the problem we usually have is that when we train it incorrectly or forget certain factors, we end up with things with like lower back pain, tight hip flexors and so forth. So today we're going to be looking at the anatomy of the muscle, but then looking at it in a different perspective, which will then help you change your outlook on the way you train it, and then also look at different factors prior to working on it with any of your clients or your patients. Okay, so from an anatomy point of view, so from an attachment site perspective, this is the ilium. So we have the posterior aspect of the ilium. We also have the sacrum here, and then here, which isn't on the skeleton, we have the thoracolumbar fascia. So we have posterior aspects of the ilium. We have the sacrum, thoracolumbar fascia here, and this is an attachment site for the glute max. It also goes into the posterior aspect of the femur onto the greater trochanter, and it also will blend into the TFL as well, depending on which text and again depending on the individual. But the main thing is, if you're not really good with your anatomy, it attaches all around this area here, and then it goes into the back of the femur. So if we're looking at this from a traditional point of view, or you look at it in most textbooks, that makes the glute max a hip extender, which is basically as it contracts, it pulls the femur back in that direction. And again, that is the way we'll typically train it in the gym, where anything that involves that motion means that the glute max is contracting. So remember, in this video, we're going to challenge the norms. We're going to look at the ways that we have previously viewed this muscle, and we're going to look at it in a much different perspective. Now, what I want you to do now is, when you're thinking of the glute max or one glute, is remember that it's not one muscle on one side of the body, but they actually work together in tandem. So the whole glute maximus is one big complex. And what that basically means is that it's just as important what's going on one side as what's going on the other side. So as one glute is shortening, the other glute needs the ability to lengthen at the same rate with the same strength in the same timing, and vice versa. And what this does is this helps us from a functional point of view, and function is going to reduce the likelihood of getting any of these negative things such as low back pain and again tight hip flexors. It's also going to enhance your ability to grow the muscle and make it stronger. So to break that down is basically, as one glute is shortening, so as it's extending, the opposing side should be flexing like this. So we have one knee going forward, one knee goes back, one knee goes forward, one knee goes back, which is basically one shortening, one lengthening. That is otherwise known as walking. But that's not the only process that is going on. As this knee is coming forward and flexing, so one glute is lengthening, that knee will also be externally rotating. As this knee is coming back, it will be internally rotating. As this knee is coming forward and externally rotating, it will be abducting, so going out to the side. And this one will be slightly adducting. And what all these processes do is they give us this nice rotational and frontal plane movement, which is just a gentle hip movement and rotation which takes strain away from the lumbar spine. So in other words, if you have good amounts of abduction and internal and external rotation, you're going to take the strain off the lower back. What this translates to is that basically we want to look at positions which challenge stability in one glute and look at the ability to lengthen on another side. When we do this, so when we actually look our ability to stabilize in this position, it's going to give an idea to how well we function. So if you have any asymmetries yourself, or any of your clients and patients have asymmetries, what we're going to do now is look into the gym and look at some very, very simple movements, which aren't necessarily going to create or improve your ability to grow the muscle. So these aren't hypertrophy movements in the slightest, but they are very good at looking at your ability to stabilize positions, which improves function. And remember, we want the function to be optimal to reduce the likelihood of injury and enhance your ability to do the movements which do lead to hypertrophy, such as your squats, deadlifts, lunges, and so forth. So this is the glute bridge variation that we're going to be looking at, which follows on from the principles that we just discussed regarding functional anatomy. Now, what we're going to be looking at here is different variations that you can use with people based on where they're currently up to, because even though it doesn't look like much, this is actually a really challenging exercise to do, especially with beginners, and especially if you're dealing with people who may be older or have an injury. So we're going to be going into a position where everything can feel comfortable. Now you might want to get a block and just place it behind somebody's head, just so they're not overly straining the neck, because that is a very, very common thing to happen when doing glute bridges of this nature. So we're going to be into this position here, like so. And then you're just going to, first of all, tuck the pelvis underneath slightly. So we're creating just a slight tuck and bringing ourselves up into a glute bridge position. So we have a slight tuck, and I'm not going to fully extend the hips too much, because one thing that you may find with people is that as soon as they try and extend, it actually all happens through the lumbar spine and not actually through the glutes. So we just want to drop the hips down slightly in that position. Once we're in this position, we're then going to go into a single leg by just straightening one leg. Now, one of the things that you can do is just use your hands to your advantage to begin with. So in other words, place your hands in a position which supports yourself so that you can actually do the exercise well. So we're going to extend up, and I'm going to stretch this other glute by lifting this leg out in front of me like so. So now I've created a lengthening in this side, so in my right side, and I'm shortening the left. Now, once in that position, then I'm going to start to think about my hip placement, because my hip may drop down like so. So if my hip is going to drop down, we want to level it out and make sure that the person has the ability to keep themselves level like this. Now, when you do that, when you keep the pelvis in one position, you're actually driving internal rotation on this side, which is what we want. So just by keeping the pelvis level, this hip will be internally rotating. So again, hands somewhere where they can support. I'm going to go down into the position. I'm going to stretch this glute like so and bring it back down. And what you're looking to do is look at someone's pelvic position. Now, it's really common when in this position that people might say, I can feel my front of the quad working. And again, that is something due to the fact that they're not quite used to using the glutes, and they're actually putting a lot of the stress through the rectus femoris muscle, because they're essentially kicking the floor away more than they can push the hips up. If that's the case, tell them to bring the heel closer towards them, so heel closer towards your bum, and don't push your hips just as far up. So in other words, keep them in this position. Now, I said about matching with the breathing. What we're going to do from a breathing aspect is you're going to breathe in and really lengthen the leg as much as you can, and breathe out and bring it down. So breathe in and breathe out and bring it down in that direction. So in doing so, what we're doing with this is we're matching an inhalation as we're trying to lengthen the muscle, which can be beneficial, and an exhalation as we're trying to push through this leg, which again can be beneficial for matching the range of motion in each side. We're now going to look at some variations that you can do, which makes this even easier for people if they struggle with the one that you've just seen there. So if somebody struggles to do a glute bridge on one leg because lifting the opposing leg off is too challenging for them, simply give them something to support, such as a Swiss ball or a bench, or alternatively you could even just hold their foot for them. So what we're going to be doing with this one is first of all building up the strength in this side, so the left hand side here. So I'm going to pick up into that position. This leg is now rested because the person may not have the oblique strength to do this initially. And what we're going to do is push through here. The centre of pressure is going to be through the left heel. I'm going to keep my hips level like this. I'm going to hold this position and just breathe. So breathing in and breathing out. Now, in order to get that lengthening through this side, what you can do is as you breathe in, bring your heel to here and then breathe out. Breathe in, bring that hip up, breathe out. And the emphasis is through this side and not through the right hand side. So again, last one, breathe in like this and breathe out. Now, what you've got to be doing is thinking about what we were saying again when we looked at the functional anatomy, is which direction is someone's knees going. If you notice when somebody's driving through this left side that it's going out to the side, that is not in conjunction with what we're trying to achieve. We actually want the knee to come in just a slight amount as we're breathing out. So where you want to be looking is which way is the knee going on this side and which way is the hip going on the opposite side. Is it dropping down? In an ideal world, you want the knee and the hip to go in the same direction as if they're trying to meet, and that looks like this. So breathe in, breathe out, drive the hip up, bring the knee in. Breathe in, breathe out. And again, the goal with this one is to do quality reps and see what it looks like either side. If there's a massive difference in strength and stability from one side to the other, this is going to indicate that when this person is doing stuff like squats, deadlifts and dynamic movement, is that the heavier you go, the more likely they may be to load one side. So again, this improves function. It's not necessarily a hypertrophy movement, but it will improve your ability to get more out of the big movements which do grow muscle. So give this a try, practice it with several people, see what you find, adapt it as necessary, but main thing is to take away and look at what happens from one side to the other. Is it equal? If not, build up the weaker side, get them to spend more time there, and that'll have a good carryover effect to the rest of their training. Thank you for watching the video, and just remember, with all these type of things, context comes into it massively with each individual. So there may be cases where it may be less applicable due to somebody's injuries, due to somebody's age, and due to somebody's movement capabilities. What these are designed to do is get you thinking and highlight ways you can improve your client and patient's training through looking outside the box and thinking more about function rather than just trying to do the typical movements we do in the gym. If you find this video useful, it'd mean a lot to me if you could give it a like, and if you want to keep up to date with my latest content, make sure you hit subscribe.